Hello, and welcome to Dedicated Women's Health Specialists. We are honored that you have chosen us to care for you and your baby. We know that you will have many questions along the way. We have created this video to address some of the more common topics regarding pregnancy and prenatal care. There are currently 3 doctors in our office that provide OB care and deliver babies. We rotate call every 3 nights and every 3rd weekend, so you will most likely meet each of us at some point in your pregnancy. There is also a doctor on call 24 hours a day, 7 days per week. This doctor can be reached by calling our office number after hours. We look forward to caring for you and your family. During your pregnancy, there are many routine lab tests that will be run, most of which are well covered by your insurance. Your first visit, the pregnancy confirmation visit, you will most likely have an ultrasound and a pap smear if needed, and testing for sexually transmitted diseases, including gonorrhea and chlamydia. Your second visit will be with one of our nursing staff, which may take place in person or over the phone if you have had a baby with us before. She will take your medical history and provide information regarding pregnancy and delivery. This visit will include a blood draw for prenatal labs. These labs include a complete blood count, your blood type and antibody screen, and testing for HIV, hepatitis B, and syphilis. Based on your BMI, additional testing may be performed, including a metabolic panel and early glucose testing. A urinalysis will also be performed. These tests can give us insight into your health and help us prepare you for a safe pregnancy. During one of these first visits, you will be offered additional screening regarding your pregnancy. This includes non-invasive prenatal testing, also known as NIPT, and carrier screening. NIPT evaluates the chromosomes of the baby and can provide information regarding certain chromosomal abnormalities like Down syndrome. This test can also provide the baby's gender. Further testing can be done for chromosomal microdeletions, depending on your family history. There is also an option of invasive but definitive testing such as amniocentesis or chorionic villus sampling if you are interested. Carrier screening is a test that checks your DNA to see if you carry any common genetic conditions that may be passed on to your baby. These tests are optional and insurance coverage varies. As your pregnancy progresses, various testing will occur. Between 16 to 20 weeks, we will offer the prenatal screen or quad screen. This test checks 4 different hormone levels in your blood and provides the statistical likelihood of specific abnormalities, including Down syndrome, Edwards syndrome, Patau syndrome, and spina bifida, which is incomplete closure of the spinal canal. If you have previously had the NIPT test done, you will only need the maternal serum alpha-fetoprotein test during this visit. This hormone will provide statistical likelihood of spina bifida and other disorders like abdominal wall defects. The quad screen and MSAFP are optional tests. If these tests indicate any increased risk of abnormality for your baby, you may be referred to a genetic counselor and maternal fetal medicine specialist. An amniocentesis may be performed to determine if your baby truly has a health concern. Between 24 and 28 weeks, you will be tested for diabetes and iron deficiency anemia. Between 36 and 38 weeks, you will have a vaginal swab for group B strep, a common bacteria found vaginally. This bacteria can adversely affect the baby during delivery. If you test positive for this bacteria, you will receive IV antibiotics in labor. These tests are well covered by your insurance. During your prenatal care, you will have at least 2 ultrasounds of your baby. The first one will be a viability ultrasound, usually done at your pregnancy confirmation visit. This ultrasound will determine how far along your baby is and when your baby is due. This ultrasound can also determine if you are carrying more than 1 baby. Your second ultrasound is around 20 weeks of pregnancy. This ultrasound is to check your baby's anatomy. A certified ultrasonographer will perform this test in our office. She will check your baby from head to toe for physical abnormalities. Gender can also be determined at this ultrasound, assuming your baby cooperates with position. While this ultrasound is very thorough, some abnormalities are not detected by ultrasound and will only be evident after birth. These ultrasounds are covered by your insurance. Additional ultrasounds may be ordered by your physician, depending on specific situations or risks regarding you and your baby's health.
Nausea and vomiting are common symptoms in early pregnancy. It affects 50 to 80% of pregnancies. Mild cases of nausea and vomiting can be relieved with diet and lifestyle changes. Things such as eating small, frequent meals, avoiding fatty foods, fried foods, spicy foods, or acidic foods such as red sauce or citrus can help. Eating bland foods, dry foods, such as crackers, can help alleviate nausea. Taking ginger supplements can help with nausea. Taking over-the-counter Tums or Rolaids can help with acid reflux and nausea. For nausea, women often find relief by taking vitamin B6 and Unisom in conjunction. If those do not work, please talk to your healthcare provider and we can prescribe medications to help. If you are unable to keep food or liquids down, please call our office immediately, as you may need to be admitted to the hospital for further care. Bleeding can happen in early pregnancy too and is often concerning. About 20% of women report spotting in early pregnancy. However, light bleeding and spotting is normal in early pregnancy. Spotting is defined as a few drops of blood on your underwear or when you wipe. It can vary in color from pink to red to brown. The most common reason for bleeding is when the egg implants in the uterus. Other common things can cause bleeding, such as having intercourse, heavy lifting, excessive exercise, or having a vaginal exam or ultrasound. You should let your healthcare provider know if you are having any bleeding.
For routine prenatal visits, we recommend an office visit every 4 weeks for the first 28 weeks, then every 2 weeks until 36 weeks, and then every week until delivery. You may have more visits than routine, as the frequency of your visits is determined by individual needs and risk factors. We check vital signs, weight, uterine size for progressive growth and consistency with your due date, fetal heart tones, urine dip for protein and glucose, and answer any question that you may have. One of the most important things during pregnancy is good nutrition. Eating well helps you handle the extra demands on your body from pregnancy. If you are pregnant with one fetus, you will need to consume about 300 extra calories per day. That's approximately a glass of skim milk and half a sandwich. During the first trimester, typically no extra calories are needed. During the second trimester, you will need 340 extra calories per day. In the third trimester, 450 extra calories a day. Avoid eating unpasteurized milk and foods with unpasteurized milk, such as soft cheeses, including Feta, Casablanca, and Fresco, Camembert, Brie, or Blue Wing cheeses, unless labeled with pasteurized milk, due to the risk of bacteria. Avoid eating hot dogs and luncheon meats unless they are heated until steaming hot before serving. Avoid eating raw and undercooked seafood, eggs, and meat. Avoid refrigerated pate and meat spreads and refrigerated smoked seafood. Do not eat sushi made with raw fish, though cooked sushi is safe. Other things to avoid are alcohol, tobacco, drugs, and marijuana. Weight gain during pregnancy depends on your health and your body mass index before you are pregnant. If you were underweight before pregnancy, you should gain more weight than a woman who had a normal weight before pregnancy. If you were overweight or obese before pregnancy, you should gain less weight. If your BMI is less than 18.5, the recommended total weight gain with one fetus is between 28 to 40 pounds. If your BMI is between 18.5 to 24.9, your recommended weight gain is 25 to 35 pounds. If your BMI is 25 to 29.9, your recommended weight gain is 15 to 25 pounds. If your BMI is 30 and above, the recommended total weight gain is between 11 to 20 pounds. During the first trimester, you might gain only 1 to 5 pounds or none at all.
Regular physical activity in all phases of life, including pregnancy, promotes health benefits. The current recommendation is to achieve 150 minutes of physical activity per week or 30 minutes 5 days a week. Regular exercise during your pregnancy increases your chances of having a vaginal delivery while lowering the chances of diabetes, high blood pressure, and preterm delivery. The following exercises should be avoided as they put you at higher risk for falling on your abdomen: motorcycle riding, skiing, water skiing, skateboarding, and bike riding. Hot yoga and hot Pilates should be avoided as well. Many other physical activities can be done for exercise, such as walking, dancing, using weights or resistance bands. As long as you are able to carry on a conversation while exercising, you are not exerting yourself too much. If you start to have vaginal bleeding, regular painful contractions, or leaking of fluid during or after exercise, please let your healthcare provider know.
Pregnant women can travel safely until close to their due dates in most cases. Traveling is typically not recommended for women who have pregnancy complications such as preeclampsia, pre-labor ruptures of membranes, or preterm labor. The best time to travel is mid-pregnancy or 14 to 28 weeks. During these weeks, your energy has returned, morning sickness is improved or gone, and you are still able to get around easily. After 28 weeks, it may be harder to move around or sit for long periods of time. Most airlines allow pregnant women to fly domestically until about 36 weeks of pregnancy. Deep venous thrombosis, or DVT, is a condition in which a blood clot forms in the veins, usually in the leg, that can lead to a dangerous condition called pulmonary embolism. Pulmonary embolism is when a blood clot travels to the lungs. Being pregnant is a risk factor for DVT, and research demonstrates that travels lasting 4 hours or more, whether by car, train, bus, or plane, doubles the risk of DVT. If you are planning a long trip, you should take steps to reduce your risk of DVT. You should drink lots of fluids without caffeine, wear loose-fitting clothing, and walk and stretch at regular intervals. Compression stockings, either below the knee or full length, can be worn to help prevent blood clots from forming if you do not have contraindications to wearing them, such as circulation problems. Common symptoms in pregnancy are heartburn, edema, and skin changes. Heartburn and indigestion can be caused by pressure on the intestines and stomach, which pushes stomach contents back into the esophagus. However, progesterone hormone plays a major role, which relaxes the muscle surrounding the lower part of the esophagus, just above the stomach. These symptoms can be minimized by eating smaller meals and avoiding lying down soon after eating. You can also take Tums or other medication we approve for additional relief. Mild swelling is common during pregnancy. Lying on the left side, elevating the legs, and wearing support hose and comfortable shoes may help relieve swelling. Skin changes due to fluctuation in hormone levels, including hormones that stimulate pigmentation of the skin. Brown blotchy patches may happen on the face, forehead, and or cheeks, and is called cholomasma, or the mass of pregnancy. It typically disappears shortly after delivery. Using sunscreen can reduce the amount of darkening that occurs. Darker pigmentation may also occur in the areola, the line down the middle of the abdomen, freckles, and moles. Pinkish stretch marks may appear on the abdomen, breast, thighs, or buttocks, and are generally caused by rapid weight gain. Stretch marks usually fade after pregnancy.
Fetal movement is an indication of the health of your baby, and we use it as a measurement of fetal well-being. Babies begin to move in early pregnancy, although most women do not feel the baby move until around 20 weeks, which is halfway through your pregnancy. Each baby has its own particular movement pattern, and we encourage you to become familiar with your baby's pattern of movement. If your baby stops moving, it could mean that your baby is having problems. If you are concerned about a slowdown in fetal movement, we recommend you drink a glass of juice or eat something with sugar, lay down on your left side, place your hand on your abdomen, look at the clock, and then begin to count any movements you feel. That includes kicking and twisting. A normal baby will move 10 times in 2 hours, and often it does not take the full 2 hours to count 10 movements. After eating and drinking, if you still cannot count 10 movements, please call our office as you may need additional testing. If it is after hours and you are concerned about less movements, please go to labor and delivery for evaluation.
There are many childbirth classes available at Good Samaritan Hospital. These can be found on the Multicare website at multicare.org. Classes available include childbirth, breastfeeding, life with baby, baby care basics, newborn care, safe sleep, and more. We highly recommend these classes if you are having your first baby.
Signs and symptoms of deep vein thrombosis can include swelling, pain, red or discolored skin, and a feeling of warmth in the affected leg. The pain often starts in your calf and can feel like cramping or soreness. The signs and symptoms of a pulmonary embolism include sudden shortness of breath, chest pain or discomfort that worsens when you take a deep breath or cough, feeling lightheaded, dizzy or fainting, rapid pulse, and coughing up blood. Preeclampsia is a condition that can occur in pregnancy that affects blood pressure and vital organs. It can sometimes develop without any symptoms. High blood pressure may develop slowly or suddenly. Monitoring your blood pressure is an important part of prenatal care because the first sign of preeclampsia is commonly a rise in blood pressure. Other signs and symptoms of preeclampsia may include excess protein in your urine or additional signs of kidney problems, severe headaches, changes in vision such as temporary loss of vision, blurred vision or light sensitivity, upper abdominal pain, usually under your right ribs, nausea or vomiting, decreased urine output, decreased levels of platelets in your blood, impaired liver function, and shortness of breath from fluid in your lungs. Sex during pregnancy won't affect your baby as long as you don't have complications such as preterm labor or placenta problems. Your baby is protected by amniotic fluid in your uterus and the strong muscles of the uterus. However, pregnancy can cause changes in your comfort and sexual desire. Breast stimulation, female orgasms, and prostaglandins in semen can cause contractions. We recommend avoiding sex if you have unexplained vaginal bleeding, leakage of amniotic fluid, premature opening of your cervix, a history of preterm labor or premature birth, or placenta that partly or completely covers your cervical opening called placenta previa.
We encourage you to ask questions during your pregnancy. The best way to have your questions answered is to write them down or make a list on your phone to discuss them with your healthcare provider at your next visit. You can also send us a MyChart message or call us if your question cannot wait until the next visit. We check messages daily. Please bear in mind we are seeing patients during the day and it may take a few hours to respond. We would like to avoid you having to go to the ER, but if it is a true emergency, you should go to labor and delivery for evaluation. If it is after office hours and you have a concern that you feel cannot wait until the morning, please use our answering service.
Special testing during pregnancy is generally done when there's an increased risk of pregnancy complications or stillbirth and include non-stress tests, NST, and biophysical profile, BPP. Most common indications include diabetes, high blood pressure, concern about fetal growth, decreased fetal movement, vaginal bleeding, advanced maternal age, and other medical problems of pregnancy. NST measures the fetal heart rate in response to fetal movement over time and takes at least 20 minutes. A belt with a sensor that measures the fetal heart rate is placed around your abdomen, and a machine records the fetal heart rate. A BPP may be done when results of other tests are non-reassuring. A BPP involves monitoring the fetal heart rate in the same manner as a non-stress test and an ultrasound. It uses a scoring system to evaluate fetal well-being in 5 areas: fetal heart rate, fetal breathing movements, fetal body movements, fetal muscle tone, and amount of amniotic fluid.
2 questions we are often asked are, when do I go to the hospital and how do I know I am in labor? Well, there are a few things that can happen at the end of pregnancy that signify you are going into labor and should head to labor and delivery. If you are experiencing vaginal leaking or regular painful contractions, those are indications that labor has started or you should head to labor and delivery. If you are having contractions that are becoming more regular and more intense, usually we say 4 minutes apart, you should go to labor and delivery. You may also lose your mucus plug after 36 weeks, but if that is not followed by regular contractions or leaking of fluid, you do not need to go to labor and delivery. Some women have spotting or pink-tinged discharge after 36 weeks, which is a sign your cervix may be dilating, which is common, but call us if you are concerned. If you have period-like bleeding, that is not normal and you need to be evaluated at labor and delivery. If you have any concerns, please contact your healthcare provider.
When you have finally arrived at the hospital to have your baby, you can expect excellent care from the nurses and physicians at Good Samaritan Hospital. Our labor and delivery unit is one of the best in the area. We have very large rooms to accommodate your spouse and visitors. Your baby is expected to room in with you for the entire stay, unless the baby has specific needs and must be in the nursery. Our nursery is certified to care for babies that are born after 32 weeks and beyond. Tacoma General is prepared to care for any infants under 32 weeks or that require special care. In addition to our amazing nurses on staff, we also have a hospitalist OBGYN on staff that may participate in your care if needed. Your labor will be managed by your primary physician during the day. After 5 p.m., all labor is managed by the on-call physician from our group. While most patients can expect to deliver vaginally, you can be reassured to know that your physician is qualified to perform a cesarean section if needed. The decision to perform a cesarean is not taken lightly and will only be utilized for the health and safety of you and your baby. Occasionally, your baby may require an operative vaginal delivery with a vacuum or forceps. These specific situations will be discussed in detail as they arise in labor. During your labor, you will have many options for pain control. Whether you decide on a natural delivery, IV pain medication, nitrous oxide, or epidural pain medication, we will be there to support you. Once your baby has delivered, you will be required to stay 24 to 72 hours for recovery, depending on the type of delivery you have. Our nurses and staff will assist you with caring for your infant and will also help you with breastfeeding. You will have 1 to 2 follow-up visits with our office after your delivery, depending on your route of delivery. Contraception can be addressed at one of these visits. We encourage you to call our office with any problems that arise after delivery. We are here for you if you need us. While it is normal to have some baby blues after delivery, we encourage all patients and spouses to be aware of postpartum depression. If you feel empty, emotionless, or sad all or most of the time for longer than 2 weeks after delivery, please call our office for an appointment. Depression can also present as anxiety, irritability, or with physical symptoms. If you are not sure if you have depression, you can still come in and talk with us. Having a newborn is a tough and challenging time for everyone. If you feel you are not coping well, please contact us. We have many resources to help. Thank you for watching our video, and we hope this helps to prepare you for your future visits to our office and ultimately the delivery of your little one. We look forward to getting to know you and your family. Please let us know if there is anything you need along the way.